Okay, well, we will go ahead and get started. Thank you for joining North Kansas City's Hospital Long Hauler Series. Today, we are going to be listening from Kaylee. She is in physical therapy here at the hospital, and she's going to be covering conquering everyday activities. So, this event is being recorded, and we will place it on YouTube for future viewing or for sharing. At any time, you can ask a question by using the chat feature or by using the Q&A feature, but we will be answering those questions at the end. So with that, I will go ahead and hand it over to Kaylee.
Hi, thank you for the introduction. My name is Kaylee. I'm a doctor of physical therapy at North Kansas City Hospital's outpatient department. I kind of helped create the long haulers program that we have here. As we've seen more and more cases, especially with long haulers, we've had to develop a program in order to help people on the path to recovery. And so we're going to talk about conquering everyday activities, but I'm kind of going to start with what is long COVID? We know what COVID-19 is and how it affects different people differently, and how most people's experiences are quite unique and individualized. So long COVID is defined as having COVID-like symptoms that persist for more than 12 weeks. And anyone can get long COVID who has had COVID-19 in general, no matter the severity, whether it's a mild case, a moderate case, severe, whether you're hospitalized or if you're recovering at home. We've even seen very, very mild cases develop long COVID. So they've had symptoms lasting 12 weeks beyond their initial symptoms and they're beyond the initial diagnosis of COVID-19. And with that, I said earlier, everyone recovers differently. COVID has over 200 symptoms that you could be experiencing. Some are very predictable symptoms. Some are very unpredictable symptoms. Sometimes they can be a cyclical pattern, and sometimes who knows what's going to happen. And so with normal progression from recovering from an illness or surgery or an injury in general, we do more of a graded approach to rehab. We slowly add stress to the body in order to recovery. That's just the normal progression of rehabilitation in general. But with COVID, it's a little bit different. We can't really use the same approach that we've been doing with a normal illness because everyone has such different symptoms and such different experiences in general. We can't progress the same way that we have been before. So we take more of a pacing approach, which is a lot different than what we normally do. And the main symptoms that we've really been seeing lately have been fatigue. That's usually the biggest one. The feeling of shortness of breath or shortness of air, and as well as brain fog. Those are kind of the main ones that we've been seeing. But like I said earlier, we've seen over 200 different types of symptoms in there. So we're going to kind of talk about how to get back to those daily activities, especially with those with fatigue, because we can't really just push through like we do normally. We have to take a pacing approach. And then I'm going to talk about what I mean by pacing. So first, what I want you to think about when getting back to normal activities is how many activities can you do in one day without becoming completely exhausted? So how many can you do, whether it's a big activity like running an errand, that takes a lot of energy to get out and about in public, or something as simple as changing the washing machine over to the clothes from the washing machine over to the dryer. How many of those activities can you do in one day without feeling like you cannot get out of bed the next day? Because we want to avoid this boom and bust cycle, kind of like when you feel really good, when you have a great day and you're like, yes, I feel almost normal again. I'm going to do all the chores that I can do just because I know I may not feel great the next day. Well, then the next day comes and you can't get out of bed. So we're trying to avoid that cycle of doing so much in one day that the next day or the next couple of days, you really pay the price for it. So what we're going to talk about is kind of the 3 Ps. And the National Health Service, or the NHS, which is formed in England, that is one of their big healthcare providers, they came up with the 3 Ps. And that's what we're going to talk about today. So the first P that we have, if I can pull up my PowerPoint here, is pacing. So we're going to break up your activity. Instead of making dinner all in one go around, where you stand for an hour and you make dinner, we're going to try to break up that activity. So maybe chopping your fruits and your veggies in the morning, and then we're going to later on cook the meat or whatever you have, and then later on we're going to put it all together. So that way you're breaking up that activity throughout the day versus standing for a whole hour just to make dinner, because sometimes standing for that long or even 30 minutes may be overdoing it to the point where you're like so fatigued that you have to sit and rest and you can't really do anything else the rest of the day. So pacing is, we're going to break up the activity during the day. We can do that with laundry too, wash it in the morning, dry it in the afternoon, fold it the next day. Even you can break up your activity throughout the day, but you can even break your activity throughout the week if you need to. I know that we like to get things done as soon as we can, but do you have to? And then the other thing with pacing is build in those rest breaks. We need to take a rest, because when we add too much stress to that body, you're actually inhibiting the way that you recover. So even when you don't feel tired, take a rest break. Chop those veggies in the morning. Okay, now I'm going to sit and rest for 30 minutes. And then get up and do another small activity. Take a rest break. Even when you're not feeling tired necessarily, take that rest break, because you're going to notice that later on, you've done way too much in the morning, and now this afternoon, you can't do anything else. And then when you take those rest breaks, make sure that you're not having any screen time or any stimulating activity with those rest breaks. So even watching TV is stimulating for your brain. So when you take that rest break, sit, lay down, take a nap even if you want to, but just make sure you're not having your phone or your tablet or your TV out, or even having conversation. Conversation is actually very stimulating as well. So make sure that those rest breaks are very restful breaks in those. And then the next one is planning your activities. So planning your day or planning your week, especially if you're breaking that activity up through the week, plan what days you're going to do those activities. So write them down if you need to, especially if you're really dealing with some brain fog. Make a list, write it all out. I also like to include a walking program with my patients with these, because slowly adding some activity in there besides just your normal activities does seem to help. So figure out what time of day that you feel like you have the most energy. Do you have the most energy in the morning? Is it in the midday, or is it at the evening? A lot of times people are completely different on these. So you figure out what is best for you. If you feel like you have more energy in the morning, plan to do your more tiring exercises or activities in the morning, and then your lighter things in the afternoon. So if you really need to go run that errand, try to do it in the morning, and then save your smaller tasks for the afternoon. And then modify as well. So just because you have this plan doesn't mean that you have to do it the way that you've always been doing it. You can always sit to do something, sit to fold laundry, sit to cook, whatever you need to do. And it's okay to ask for help sometimes too, especially with lifting that laundry basket or that heavy pan. Ask a family member, ask whoever you live with to come help you with those things. That's okay to do as well. So modify what you can do, because you want to kind of conserve that energy. We don't want to burn it all out in the morning, and by the rest of the day, you can't really do anything. So really modify what you're doing to your best ability. So that way you've got enough energy throughout the day. And that way you can get everything that you need to get done. And the last one is prioritize. What has to be done today? Okay, well, I didn't get to the dishes yesterday. Now they're starting to pile up. I need to get the dishes done today. So I'm going to start with the dishes, and then maybe I'll wait on laundry till tomorrow. Or, I really have to run this errand today, so I'm going to put some of the other things off till tomorrow. What is the most important thing that you have to get done today or even this week? Make sure that you also include enjoyment, like fun activities, into those priorities. Because when you're so focused on trying to just get one activity done, you need to have some kind of enjoyment with those things. That way It's not just mundane every time that you're like, oh, I have to get this activity done. Do something for fun, even if it means you have to spend a little bit more energy doing it. So the 3 Ps are a great place to start. Breaking that activity, planning your week, planning your day, and then figuring out what you have to get done with all of these. So during those rest breaks, another great thing to do, especially if you're feeling short of air, is to include some breathing techniques. So that's what we're going to kind of learn today. Is we're going to learn 2 different breathing techniques that way you can do during your rest breaks. That way, kind of meditate, to kind of calms your brain. Even when you're sitting and thinking for someone, that actually expends a lot of energy as well. So the first breathing technique we're going to do is pursed lip breathing. So what you're going to do is you're going to breathe in through your nose and out through your mouth. So you're going to breathe in like you're smelling some nice, pretty flowers. And then breathe out like you're blowing out your birthday candles. So that's a good one, especially when you're feeling really short of air, to kind of slow down your breathing. Because if you start to hyperventilate, that's going to make things a little bit worse. It's going to make your heart rate go up, and it's going to feel even more out of air than if you slow down and take a nice deep breath in through the nose and out through the mouth. And then the next one is 4 square breathing. So you're going to breathe in for 4 seconds and hold it. You're going to breathe out for 4 seconds and hold it. So what I like to do is I like to make a square with it. So you're going to go breathe in. So it's going to go 4 up, hold for 4, out for 4, hold for 4. So doing those techniques while you're resting can be very helpful in just kind of slowing down your body. And one thing I would recommend to most people is to buy a pulse oximeter. So you can buy them at Walgreens or any other place that has medical devices. And what it does is it checks your oxygen rate. So 100% is the best that we're going for, and kind of just keeps an eye on that. So even when you're feeling really short of breath, put that on and see where your oxygen is. And then try your breathing techniques to see if that does help with the breathing. And then check your heart rate as well. So a lot of times when we're in therapy and doing our long haulers program, we like to make sure your vitals are doing okay while you're doing these. Because if you're adding too much stress to your body doing these activities, you need to modify it somehow. Too much stress on your system is not great for your recovery process with long COVID. And so we just want to make sure that you're doing okay with those. And then consult with your primary care physician if needed, if you feel like there's an issue with those. So what we really like to do is just make sure that you're pacing yourself. You're not expending all of your energy all at once. And that way you're really getting the task that you need to get done. And then slowly, after a week or 2, try to add another activity in. See how many activities I can do now this week instead. And then, like I said earlier, with that walking program, try to add in about 5 minutes of walking per day. We want to go from really good days and really bad days to more of an even, consistent day and a week. So every day is about the same versus going really good days and really bad days. So as you feel like you can kind of get fairly consistent days where I can do 5 activities in a day without totally overdoing it. Great. Do that for a week or 2. See, okay, I'm still staying pretty consistent with doing 5 activities a day for an entire week. Okay, I can do it for 2 weeks now. Now let's add in another activity, a small one at that. Okay, I can do 3 big activities and 3 small activities a day. Great. Try that for another week. Is it consistent for the next week? Great. Add another activity in. So we're slowly getting these builds into more and more activities. I know these are very small baby steps, but that's what we need to start with in order for you to notice the big differences. And you may not even notice these differences. Your family members or whoever you live with may actually notice these differences in your energy level, in your mood, and all these other things before you do. But these small changes are what you really need to recover from long COVID. And it may not be in the time frame that you want. There's a lot of research right now that shows we don't really know what's going on. And there's more continuous research that's being done since we've been, approximately 2 years from the initial start of COVID here in the United States. And so it's going to take time. You've already maybe been dealing with this for 6 months to a year. It'll keep slowly, progressively getting better. And every recovery is different. You may recover a lot faster than someone else that you know, and that's okay. But just keep with those small changes over time, you're going to notice a big difference. And if you feel like you really are struggling with getting back to conquering those daily activities, consult with your primary care physician and about a possible referral to physical therapies. That way we can help you and we can educate you. We can slowly build in that activity like a walking program, like a strengthening program, in order to build up your endurance level. That way you can do more activities at home. So, you know, if you have any questions about that, always try with that primary care physician first, and then come see us. We are dealing with a bunch of different individuals right now who are going through the same process, but every recovery is so unique with each person. But education and starting with this alone is going to start with your road to recovery. Let's see here. So as you can see with some of these that we've gone through, you can even use adaptive equipment if needed. Rearrange your activities, rearrange your items that you use the most onto eye level. That way you don't have to increase that energy expenditure to get whatever you needed. And then always ask for help as well. There's some great resources with the World Physiotherapy that kind of explains what long COVID is and how to recover and how to kind of go about these exercises and breathing exercises. And like I said, another resource is us down here, and we're on the second floor of the pavilion. If you ever need anything, we are a great resource for that. You can just stop by and ask too. So really, we use our resources, use our knowledge here, because you can recover from long COVID. It just may not be in the time frame you want, but you can get back to conquering your everyday activities.
Okay. Thank you very much. Kaylee, do you have a moment to maybe have some questions?
Yeah.
Okay. Well, guys, if you guys have any questions, please feel free to go ahead and chat or Q&A. I think it's really important that, Kaylee, this topic, because, you know, I think most of us just want to get back to what we thought was normal. And that's a hard process to, you know, not be able to just jump right back.
Definitely. And it's hard to realize that you're not going to be able to do the things that you were doing before. You have to make these modifications, which is hard to in the beginning. But honestly, once you do that, you're going to notice a big change in your energy level just from making those small modifications of what you're doing and not trying to jump back into your normal life like you were.
Okay. And I know that one of my hardest things, honestly, is, you know, when you feel great, you just do way too much.
Definitely. And that's a big problem that we've been seeing is you want to get everything that you can done in that day that you feel great, but you may be down for the next 3 days afterwards. So is it really worth it when you do that?
Absolutely. Agree. Okay. Well, Kaylee, I'm going to go ahead and say thank you very, very much. I appreciate you speaking with us today. And if you guys have any questions that pop up in your head, go ahead and reach out to Community Health and Wellness, and we'll see if we can't get those answered for you. All right. All right. Well, you guys have a good day. Thank you, Kaylee.
Thank you.